Hey guys, welcome to the DPC Doc channel. My name is Sean James. I am Chief Operations Officer of Harris Internal and Functional Medicine located in Peachtree City, Georgia. And with me is my wonderful and beautiful other half, Dr. Erinn Harris James, also of Harris Internal and Functional Medicine. So guys, we're going to jump right into it today. We're going to talk about exactly what our practice does, how do we help our community, what services we provide, and a little bit more about the physicians and our staff here at Harris Internal and Functional Medicine. So if you can, Dr. Erinn Harris, if you can, just tell us a little bit about, what do we do?
Pretty much everything. Our focus primarily initially when I started the practice 10 years ago was on primary care. I was trained as an internist at Emory University, and I decided I kind of wanted to jump off the ledge and jump into a new type of model to take care of patients, which really allowed the doctor and the patient freedom to for me to take care of them, for me to be their advocate, for choices not to be made by insurance companies. So direct primary care really moves insurance companies out of the way as a middleman, as a middle person, and we directly take care of our patients by a membership model. So they pay a monthly membership or a quarterly membership or a biannual membership or a annual membership, and we allow this membership to cover office visits and any other telecommunications visits, any office procedures. And so I flourished under this model. I wasn't bound by insurance companies any longer. I had insurance companies not dictating what I could and not couldn't do for my patients. Really found very good prices on labs and radiology for ancillary services, and really just have boomed, especially during COVID. We definitely boomed during COVID because we had already been practicing the model of being accessible to our patients and having telemedicine. And we were the ones who would see our patients. We wouldn't see our patients out in the parking lot. We actually saw them in the office. And if they were not able to get out of the home, then we could see them in the home or we could see them by telemed. So, we have transitioned in the last, I would say, 4 to 5 years into a functional medicine, because functional medicine allows us to really get to the root cause. Functional medicine is root cause medicine. And because I was spending so much time with my patients, because I was actually seeing, well, what's really going on with you? Why are you having high blood pressure? Why are you having high blood sugars? Why are you having this chronic medical illness? Why do you have this chronic headache? Then I really had time to really look into their chronic problems, and which led me to the practice of functional medicine. I became certified through the Institute of Functional Medicine in 2002. It took about, it's a 2-year, it's like an additional training to what I had already had as a foundation in internal medicine. So it was a 2-year process of getting certified in functional medicine, and definitely can see me up on the IFM website. I am a certified functional medicine physician through IFM. So we're able to really help patients on a broader scale of maybe, if they don't know what's going on with them, they've been to multiple doctors, we can now say, hey, this is what is actually going on with this is your root cause issue of what's causing your high blood pressure, or what's causing the rash, or your inability to lose weight. So it's been really, really rewarding, very helpful for my patients. And we just love what we practice. We love what we do. So, and in addition to that, we've actually added on, as an extension to that, we have a lot of people who say, yeah, you treated Lyme, but I still have the hair loss from Lyme. Or you've helped me with arthritis, but I still have a lot of pain from arthritis because it's progressed. And so we've added on a wellness component for people who have vascular issues or prostate cancer and they have erectile dysfunction, or they've had breast cancer and they can't use estrogen replacement therapy. So we actually use vaginal rejuvenation for that. So IV therapy to add on for my patients to help detoxify them, to replace nutrients and vitamins. And so it's been a really great addition, a well-rounded practice as has developed as a result of me just having that foundation of direct primary care.
Wow. Okay. So another question I want to ask is, obviously people are still kind of with this insurance model. Some people have Medicare, Medicaid. Obviously they're dealing with co-pays. Why was it that direct primary care was the route that you wanted to go as a doctor who had been in these other areas like the VA and the hospitalization and things of that nature?
Well, I really realized as a result of me being in the system, in a sense, in the system for, I would say I started practice in 2001. So I would say about 12 years, I burned out after about 12 years. And after about 13 years, I decided direct primary care. Well, the reason why is because I realized that insurance did not equal good health care. It did not equal me spending time with my patients. It didn't equal me really being able to dive in. And when I was seeing a patient every 7 minutes, I felt like I was missing a lot. And so I really felt like there was a better way. Even though a patient had Medicare, doesn't mean that they were getting good care. And so I still have Medicaid patients. Medicaid patients still maybe didn't have a lot of options, and my membership prices were low enough. We charged based on age. So a person who is about 25 will pay $45 a month. A person who is about 45 will pay about $65 to $75 a month. I think 95. I have to look at my prices again. Right. But it allowed those people who really couldn't afford to go elsewhere and get better care to still, get really good service and healthcare and have concierge type care for a lower price.
Wow, great stuff. So with that being said, we talked about primary care, okay, as the beginning foundation. Then of course you transformed into or added on to functional medicine, and also then we integrated wellness as a whole wellness center. And so that's really important because I see a lot of people are in this mode now where they don't want to take pills and cover up pain and just be addicted to medications. So tell me about your philosophy as far as wellness is concerned and how you look at treating people that are coming in with chronic or acute illnesses.
I really look at the person as a whole. Medicine has divided our organs up as if they are not in our same body. Like as if your brain is not connected to your heart or your gut is not connected to your brain in some type of way. Like your body is in these separate compartments and they work not in conjunction with each other, right. Which is really doesn't make any sense. And so we've separated specialization, like a gastroenterologist will not communicate with a cardiologist, and a cardiologist won't communicate with the endocrinologist who deals with hormones. And it's all as if all of these things are separate organs and they don't function in one body together. And so my draw was, and why I started being able to see the patient as a whole is because everything works together. Your gut affects your brain. If your brain is not working correctly, it affects your cells. It affects your mitochondria. Even to the very cellular part of your body, even to the least functioning thing. If you have a cell, a group of cells that's not functioning to the highest capability they can function, then you have tissues that don't function well, and then you have organs that don't function well, and then you have a body that doesn't function well. And so you actually, I look at the body as a whole. And we develop the wellness portion to support what maybe on the outside. If you have had a lot of weight loss and now you have a lot of skin laxity, well, we can fix the inside, but that skin laxity is going to be there.
Right.
And so we actually treat the the skin laxity. Or if you've had a lot of weight loss because we've helped you lose weight and you have stretch marks because gain weight and you have stretch marks, then we treat the stretch marks. And so, so we kind of treat not just people want to feel good on the inside, and after they feel healthy, they also want to look good on the outside.
Absolutely.
And so it's the whole person, treat the whole person.
I'm excited. I love what we do here at the practice. So I do know part of your philosophy is not just prescribing medications, but it's also looking at the diet and lifestyle and whole foods. Just dive just a short bit into how big food allergies have been in the patients that you've been seeing, and how those lifestyle changes have been more paramount to dealing or fixing or resolving some of those issues versus just throwing medicine at it.
So I have a lot of people who would come in with like fatigue or rashes or headaches, migraines, or the inability to lose weight. And a lot of that is based in what we call food sensitivities. A lot of people think, I don't have a food allergy because I don't get a rash, or my face doesn't swell after they think of peanut allergies, and I don't have facial swelling after, I eat a peanut. But you still may have a food sensitivity. You may have joint pain, or you may have bloating or gas or swelling, or you may have this rash that just won't go away. Because you're eating a specific food that you're intolerant to. And so that has been a huge, a huge implication for a lot of illnesses that come in. And so I have a lot of people say, I don't think I have any food allergies. And then we go through our food and sensitivities, should I say, but we go through an elimination diet and remove milk, and all of a sudden, oh my gosh, my joints don't hurt anymore. But that rash went away. I've had this rash for 2 years and it went away after 2 weeks. Or they have yeast in their gut throughout their whole system, and they have this, area on their head that they're losing hair, what we call alopecia. And all of a sudden they, when we take out the yeast and treat the yeast, their hair starts growing back.
Right.
So yeah, we actually, we have seen a lot of just removing certain foods. We've seen a lot of improvement in chronic illness that have been going on for years.
Okay, great. That's awesome. So we're going to move now a little bit into, let's talk about our staff, our awesome staff that we have. How long have they been with you? And, who are these individuals because I know it's not just obviously just you and me. It takes a whole team to take care of our patients. And so if you can describe a little bit of that, and then we'll move into our wellness part.
Okay. All right. So our staff are great. We have a great staff, and I believe in treating staff well that do a great job. And so we try to really foster a culture of family and peace and having fun at work and a joyful atmosphere, and relaxed, a relaxed atmosphere, not tense. So we have really great people. My office manager, Marley, has been Marley Harlfinger. She's been with me. Well, she started with me when I was in fee-for-service practice in 2008. And after I started my direct primary care practice in 2014, I was like, okay, when I need you, I'm going to bring you on. And every year she'd be like, you need me yet? I was, wait a minute, you need me? So I think she came on in 2019 finally, and her 5-year anniversary will be coming up this year. And I think it was 2 years ago, we brought on a nurse practitioner because we became so busy. She actually trained with us while she was going through her, as she was becoming a nurse practitioner, and she did her rotations with us training. She did so well. We loved her, and we brought her on. And we also have Chelsea, who does a lot of wellness procedures. She's kind of like over the wellness aspect of our practice, and she is very creative, loves to do IV therapy, and she really takes in a lot of our procedures, and she kind of takes care of the patients, but also the wellness part of our business.
She does. She does an awesome job.
Mm-hmm.
So now let's talk about the wellness part.
Oh, and then we have our CEO who actually who actually facilitates most of our marketing and culture and operations in the practice.
Well, thank you, honey. I appreciate that. Awesome.
Mm-hmm.
So we're going to talk about our wellness as far as just a little bit more in depth as far as things that we're seeing, like erectile dysfunction, vaginal dryness, vaginal rejuvenation, things of that nature. And then we're going to talk about, some of our supplemental things that are helping, because again, we're looking at the complete lifestyle of a person and trying to help as much as possible with all the tools that we can use naturally. So can you talk about the wellness a little bit more?
Yeah, so the wellness developed out of the need for things that could not be fixed by me just practicing medicine. And I saw a lot of men who were experiencing erectile dysfunction at an earlier age, and they're well into their mid 30s, early 40s. And that's something we usually don't see until, previously until late, 60s, 70s. So they say half of the men, maybe half of men over 50 have erectile dysfunction. And so it's a large number. And we think this has a lot to do with diet and the fact that they are, they may have food sensitivities, mainly inflammation. And so we actually use shockwave therapy along with exosome injections, and exosomes have a lot of cytokines and growth factors in order to kind of regrow and revitalize tissue. And shockwave therapy actually kind of breaks down soft tissue fibrosis, and it also causes the cells that regenerate tissue to come, because it causes like little injury, but not very much, but it just kind of breaks up fibrosis and allows blood flow to come into the penis, and then kind of like rebuild the tissue. Mm-hmm. And so men see usually a really good response after about 4 treatments. We do six shockwave treatments over a 3 to 6 week period, and they usually see really great results by treatment number 4. And they probably have to, maybe if they have prostate cancer, if they've had a history, it works on guys who have prostate cancer, or what we call diabetic neuropathy, where they have diabetes and it does affect their erections. We may have to do 2 separate treatments, but it actually, studies have shown that it actually really even works on guys who have prostate cancer and diabetes. Okay. So really rewarding for guys who kind of have lost faith that they won't be able to, to have erections or have a satisfying sexual life. Having sex is a part of life, and it fulfills intimacy, and it's really important for foundational health or relationships. You need to have that intimate relationship with your spouse or your partner. And so that actually fills a need that people need. And so we help with that. Along that same lines, vaginal rejuvenation for women who have gone through menopause or maybe have had a hysterectomy early. And for many reasons, women have hysterectomies early they have breast cancer early, and they can't, take estrogen, or they actually have estrogen positive breast cancer, or they just don't want to take estrogen. Some women don't want to do hormone replacement, which is reasonable. They don't think it's a good idea, or they've had a history of breast cancer in their family. And so we have vaginal rejuvenation, which restores tone. See, if they've had multiple children and they have loss of vaginal tone, it restores their tone. It restores what am I thinking of? Like the
I don't know.
I don't want to say the moisture, vaginal moisture. Thank you. It restores vaginal moisture. It helps a little bit with even bladder, a lot of bladder incontinence. Like if you are running and you have kind of mild bladder incontinence, it would actually help with that. So if you're running and you lose your urine, it helps with just that vaginal tone altogether. And you want me to keep on going on?
Well, we'll just mention a little bit, so you don't deal with Botox.
No.
And so that's really important because we are finding a larger number of people that do not wish to inject certain toxins into their body. So this really gave us a different direction to go, which I'm very, very happy and excited about as far as being wellness with I guess a touch of aesthetics. But can you talk a little bit as far as how we deal with the wrinkles and skin and things of that nature?
Yeah, so they're starting to have studies a lot. Botox really boomed during COVID because people were in front of this screen all the time, and the aesthetics business boomed during that time. But people weren't using Botox consistently, especially younger people are now using in their 20s and 30s. They're using Botox, and they're now finding that chronic use of Botox, like every 3 to 4 months, will actually start to cause muscle atrophy, and so you may not be able to use the muscles in that in your face. And so what that happens is you're like, well, great, I won't have any wrinkles, but then if you're not using your muscles, then you won't be able to have expressions, and then you can even build up more wrinkles because it actually you just don't have the muscles.
The face a little bit.
Exactly. More. You don't have anything filling in that face. So we chose to go a different route with Potenza. Potenza is radio frequency microneedling, and it actually uses heat and microneedling to cause skin tightening and wrinkle reduction, and it lasts a longer bit. Of course, lasts years.
Collagen production. Also,
yes, collagen production. Actually, yes. We'll inject hyaluronic acid or growth factors with it. We use a product called Anti-Age, which we love. We also use that Anti-Age for vaginal rejuvenation and hair restoration. We use Anti-Age with that. So Anti-Age uses growth factors and cytokines to revitalize your skin. So we use that along with our radio frequency microneedling. So a lot of people will lose weight and have lax skin here or have the crow's feet here, and Potenza, the radio frequency microneedling, helps with all of that without the use of Botox.
That's awesome. I like that. So just to recap, if you're just kind of watching us now, of course, Harris Internal and Functional Medicine, located in Peachtree City, Georgia. And of course, I'm here with my beautiful other half, Dr. Erinn Harris James here. And so we've kind of talked about the things of primary care, functional medicine, and also wellness, a whole wellness program that we have that we're really, really excited about and that we're educating people about to let them know that we're here to not only just treat them here and now for acute and chronic illnesses, but also to help them on the outside also, so that after recovery comes, we can continue to help beautify people.
Yes.
So I'm really excited about that. And so last thing we'll kind of wrap up here is we have some supplements here also, and of course you got to be picky about what you decide to have in your practice. So tell us just a little bit about these couple things, or at least the brand, and what made you decide as a doctor that you wanted to support something like this.
Well, I use a lot of different brands of supplements. There are some, because we use so many supplements in functional medicine, that we have to support what's going on in your body outside of medications, and so there are a lot of supplements that can come and aid in that support. But I really like Nutritional Frontiers because it really does a good job with some things that it doesn't, that other brands don't do. And so I really like their detox products. They have very, very great kind of nutritional support, so very great, really, really good detox products, and also products that actually aid in stomach repair. And so I chose them because they're a faith-based company. They are very generous, and they have great products. And so I love their nutritional products like this one. And they have a Proline Greens and a cleanse, what we call like a powder that kind of detoxifies you. Some really good support for inflammation. So it's just great products. Now, people are like, well, I can just go to Amazon and get my products and try to figure out something like that. The one thing that you have to know about supplements is supplements, you don't know, just like you don't know when to get your medication from a place where you don't know what's been put in there. The same with supplements. So you do want to make sure that if you are getting supplements, make sure they're medical grade. And sometimes on Amazon, you may not be getting, even though it may look like it's medical grade, you may not be getting the actual true medical grade supplement, because you're not ordering from ordering from the right platform, or from a doctor or a nurse practitioner or a chiropractor who actually has a license and can get medical grade supplements. So.
Great point, Dr. Harris. So guys, with that being said, we're going to go ahead and kind of leave you here. But what I do want to remind you is please subscribe to DPC Doc channel, because we're going to have some great content here where we're going to be talking about more issues and more things that Dr. Erinn Harris James that she deals with here in the practice, and we want to make sure that you have a very viable source to get some great information. You also can go ahead and reach us at harrisinternalmed.com. That is harrisinternalmed.com. Please check out our website. Please give us a call, ask questions. Please, call us for a consultation. We love to go ahead and have a consultation. We also do a Zoom call. If you could tell us a little bit about the Zoom call, we do that every Friday. And so, of course, you have to call in and schedule that appointment. We talk about all the services that we offer here at the practice, just to see if this is going to be a fit for you. Mm-hmm. And so we look forward to, you're not going to just talk to me, but you'll talk to your doctor directly, so you can at least find out about if these particular services, or whether you fall into the primary care section or into the functional medicine, because sometimes you really don't know. So we want to take that guesswork away from you to do that. So any last words that you want to share with
Actually, I do. Yes. So I know I had a lot of followers who were following my vitiligo blog, mm-hmm. and just to let you know, followers who are following that, I am restarting the vitiligo blog.
Yes,
so you guys will see kind of a different view of me. Actually, when I started that, I was during COVID, and now it's kind of like a post-COVID view of how to keep up with vitiligo and continue to sustain what I've already treated.
Yeah, absolutely. So guys, stay tuned for that. We have some exciting videos that's coming as far as treatments, as far as the journey that Dr. Erinn Harris is doing along her vitiligo journey here. So it's great to hear about that. And if you know anybody that is maybe on the onset of that, or maybe they're in the middle of that and they're dealing with that, please subscribe and like the channel, and we'll be able to share that information on a daily, weekly, monthly basis. So until then, we'll talk to you guys later. Thanks.
Bye.